So today we're talking about the report that was developed from pipelines to pathways, strengthening Los Angeles County nursing workforce for the future. This work started with Dr. Evans and I doing a text message regarding the nursing shortage within LA County, but also taking into account the Governor Newsom's veto of two bills last year as relates to community colleges offering bachelor's degrees as relates to nursing.
Dr. Curry, do you want to continue there? Sorry to back up one slide
Backside,
for our folks on here.
backside, yeah, back up, yeah.
There we go.
All right. So one of the things that when we were doing text messages and having conversations, we were thinking about the enrollment of students in bachelor's program and also RN programs at community colleges. But when we began having conversations with employers and other colleagues in the CSU system and also community colleges, we realized that the conversation was bigger than just offering bachelor's degrees.
Yeah, and as Dr. Curry stated, creating and sustaining a nursing workforce is critical to LA County communities, and addressing it is not a zero-sum game. I think we all recognize that as Dr. Curry mentioned, that it really required the collaboration across education, employers, government, and all the communities representative. And, as I mentioned, the CSU's system-wide headquarters is here in Long Beach. And so we're very much committed in partnership with our 5 LA County CSU campuses to really advance this. And so to that end, bringing together all those critical parties was really how this work began. With identifying some key objectives that we all shared. We knew that there's a need to address the pipeline for registered nurses in LA County. We needed more streamlined pathways. That was evident from what we were hearing from students, from our employers. And it's not just about that first step into the workforce. It's about building a sustained pipeline to keep nurses in LA County. These are excellent, well-paying careers. So how can we work collectively to support not just that entry point, but all the way through? And so really that was what brought us all together, that shared commitment. And you'll hear in the next few slides, really we started from a data-informed standpoint so that we were getting this right. So with that, I think we can transition to the next slide and kind of hear what that process looked like.
Thank you, Nathan. So our center worked in collaboration with Burning Glass Institute as well as Education Strategy Group on this very important project. For the project, we did two things. A secondary data analysis in which we used several sources. We also, ESG, conducted structured interviews and surveys with regional stakeholders. They combine that to inform this report. And so we looked at the demand for registered nurses. And as you can see there on the screen, the demand in LA County for registered nurses is great. Compared to program completers, the number of students completing registered nursing programs, we are falling short and have for some time. So if we look forward to 2035, that gap only continues to widen. That is the big takeaway. And largely, our work supports the findings from the California Department of Healthcare Access and Information, also known as HCAI. Registered nursing as an occupation has grown over 52% over the last 20 years compared to about approximately 11% for all occupations on average. The wages for registered nurses are very strong. So by all indication, this is an in-demand, high-wage occupation for our students. We also looked at job postings through our proprietary data provider, Lightcast. And we looked at those by education level and by experience level and analyzed those by those two. And we also looked at some survey data indicating that 40% of registered nurses in 2024 reported that they intend to leave the profession within the next 5 years. This is up from 29% in 22. That's a large jump. And nationally, 65% of registered nurses report high levels of stress and burnout. So the other key finding that we also found was looking at all of this was publicly available through the Board of Registered Nursing. We find that private institutions in Los Angeles County now account for 71% of approved annual enrollments, compared to a very small share now being held by our public institutions. At the same time, over the last 5 years, we saw an increasing share of awards issued by private institutions, up to now 55%. And our public institutions, our community colleges and our Cal State system, accounting for now just under or about 44%. And that has increased over time towards the favor of private institutions. That is the findings and what we did. So now I will turn it over to who is next. Narne, I believe.
Wonderful. Thank you. Well, I want to take a moment just to say good morning and thank you for joining us. I do also want to just take this opportunity to thank our partner speakers, leaders, and collaborators who made this possible today. But I also do want to give a little bit of information about the Los Angeles Regional Consortium. And for us, today represents an important moment for LA County as we come together across education, healthcare, workforce, and community to address one of the region's most urgent challenges, building and sustaining a strong nursing workforce. As Chair, Assistant Vice President of the Los Angeles Regional Consortium, also known as LARC, we represent 19 community colleges across the county. Together, we share a commitment to ensuring that California's community colleges remain accessible, affordable, and aligned to real opportunities that transform student lives. LARC's mission is straightforward: connect education to workforce needs by partnering with K-12 organizations, employers, priority industries to create clear, seamless pathways from learning to career. Our consortium model allows us to do what no single college can do alone: speak with a unified regional voice, coordinate solutions at scale, and support both students and employers across all of LA County. In the context of nursing, this means aligning community college nursing programs to clear, navigable career ladders, working closely with hospitals and health systems to expand training capacity and support the transition into practice, and using data and employer engagement to strengthen pathways and open more doors for students. Yet, even with strong student demand, we face persistent bottlenecks: faculty shortages, limited clinical placements, inconsistent transfer pathways, and varying levels of support for new nurses. This is why today's report is so important. It reflects the kind of coordinated, data-driven, county-wide strategy that LARC was designed to champion. And this slide really gets to the heart of why this work matters and why it is so critical. When the nursing pipeline is under-resourced, the impact isn't felt in the classroom or hiring numbers. It shows up directly in care across access, system costs, and equity across LA County. First, persistent staffing creates gaps and strains care delivery. Additionally, health systems pay a financial price. Third, communities feel the loss in continuity and cultural responsiveness. And finally, the impact reaches future nurses as well. Student and prospective nurses encounter barriers, limited clinical placements, long wait lists, complicated transfer pathways that make entering and advancing in the profession much harder than it needs to be. So, under-resourced nursing pipeline doesn't mean we need more nurses. It means unequal access to care, higher costs for systems already under pressure, and missed opportunities to advance equity across LA County. That's the problem the LA County Nursing 2035 initiative is designed to solve. Thank you. Next slide, please.
So what you'll see in the report, in the copy that hopefully you all have, is really the summary of what came together to build this report. Dr. Curry and Dr. Evans highlighted what was the impetus for this report, and I'll talk later about the recommendations that are embedded within them. But as you can see here on the slide, that this is really a table that was set to bring together leaders to think about what can be done to improve and expand the nursing talent in LA County. First and foremost is the realization to create a regional table for both education leaders and employers and other intermediaries that are notable and noteworthy for talking about this topic. Second is just how do we expand the capacity of our public institutions, including faculty, which are often challenging to secure because of the cost of salaries, and then also for clinical sites. And what do we do to ensure that students have that opportunity to go ahead and achieve their dream of becoming a nurse? Third is really around what can we do to balance the resources and the ecosystem around clinical placements. There are many different options for students in LA County and great options through our public higher education systems. But there needs to be a way to sort of balance that load and ensure that students have that path all the way into that job. Fourth, you'll see here is really what are the enabling conditions to think about more stackable approaches? What does credit mobility and transfer look like for students? And this is a really, really good moment of thinking about a variety of higher education systems coming together to say, what can we do through policy and practice to improve our practices for our students to have a much more seamless journey as they navigate multiple institutions to get to their goal of becoming a nurse? Fifth, you'll see there is just a shared data infrastructure, and what does that look like for bringing together multiple organizations and understanding what does the data look like, given that we've led into this report and sort of grounded the group in data, but what are the insights that can actually advance the work of them collectively moving forward? And then last but not least, are there evidence-based practices that the region can employ to reduce turnover that Luke mentioned, to ensure that there is a healthy and robust ecosystem of nursing talent, but more importantly, that our employers can thrive not only today, but in the future. We'll go to the next slide and just highlight that, again, this was, as Luke mentioned, really a mixed methods approach of pulling the data and grounding this with employer interviews, all kinds of labor market and data insights for this group to learn and talk through. And then most importantly, student outcome data and student conversations to understand what is necessary to have a much more seamless pathway into nursing jobs. This report highlighted the structural gaps that are in the nursing pipeline and we offer some actionable recommendations. And I'll just summarize them into three main buckets of what these recommendations are that you'll see in the report. First and foremost is what are the enabling conditions for students to navigate the LA region to become a nurse, and whether that's better partnerships across institutions, things that we can do around clinical placements to make sure that load is balanced in the right way. But students first and foremost is part of that recommendations. Second is really important is around employers and how do we bring employers in early and more often in the conversation to ensure that both retention and successful entry is possible for our nursing students in the LA region. Third is really centered around a collaborative infrastructure. This is not the end of the journey. This is really the beginning. This nursing report obviously sets a vision for 2035, but what's necessary both in setting a table and both incorporating technology that will keep this group moving forward and ensuring that the goals that are set out in this report can be achieved. You'll see also in there that there are clear tactics that are for each of the major segments of contributors, whether they're employers, higher ed institutions, or intermediaries. Each one has a role to play, but in concert, this will be a transformative effect for the LA region. And the most important part of this overall, and again, I want to give a big compliment to Dr. Evans and Dr. Curry. The vision is not only for a better outcome for LA County, but this is to be a model for the state and also for the nation as it relates to nursing preparation. So again, and you look in this report, this is a very, very big body, a comprehensive body of work that is really indicative of making sure that LA County has a new approach to nursing talent. With that, I'm going to hand it back over to Dr. Evans and Dr. Curry. I believe I handed over to Jim. I apologize to close us out.
Thank you and good morning. It's a privilege to join all of you today. I want to begin by thanking Dr. Curry, who I've had the privilege of working closely with, Dr. Evans, Dr. Magajan, Luke Meyer, Dr. Lovin, and all the partners who contributed to this report. What we've heard today represents one of the most comprehensive and honest assessments of Los Angeles County's nursing pipeline that we've ever had. And as an employer, I can tell you this level of clarity is not just welcome, it's urgently needed. We're in a crisis. Everything presented today reflects what healthcare employers across Los Angeles are living every single day. Vacancies that stay open for months, teams stretched to their limits, rising burnout among nurses who are asked to shoulder more than ever. And most importantly, the growing challenge of delivering the consistent, high quality care that every patient in our county deserves. Previous speakers already shared the delta between the nurses needed and the number our colleges and universities are producing. That gap has real consequences. But what we've learned and what this report makes abundantly clear is that the problem isn't just numbers. It's the lack of a coordinated system that helps students transition from education into practice and supports them through the critical early years of their careers. As employers, we see the effects of that fragmentation everywhere. Students who want to work in our community health centers and hospitals can't always find clinical placements because the system is overloaded. Newly licensed nurses are ready to begin their careers, struggle to get hired because residency slots are limited or because hiring pathways are unclear. And even when we successfully bring new nurses on board, too many leave early because they don't feel adequately supported or because administrative burdens overwhelm their ability to focus on patient care. The recommendations in this report are exactly what employers have been asking for: expanded clinical placement capacity, stronger, better aligned ADN to BSN pathways, shared data systems that allow us to plan for workforce needs rather than react to them, clearer and more supportive transition to practice programs that build confidence and reduce early career turnover. And critically, a regional intermediary that can help knit all of this work together so that colleges, hospitals, community health centers, and workforce partners are moving in the same direction. As employers, we're ready to be full partners in this effort. We're ready to expand clinical training opportunities. We are ready to participate in coordinated planning, and we are eager to help build the transition to practice models that we know improve retention and support our newest nurses as they grow into confident, capable clinicians. Let me close with this. The data in this report makes clear where the nursing pipeline is falling short and what it will take to strengthen our region's workforce. If partners commit to these recommendations, Los Angeles County can bring more nurses into the profession, support them to stay, and build the stable, resilient workforce our healthcare system and our patients deserve. Thank you to all the partners who made this report possible, and thank you to everyone for joining us today. Together, we have the opportunity to modernize our county's nursing workforce. Turn it over for questions.
Diana, will you please are able to moderate or facilitate any questions people have?
Yeah, I let folks know that you can drop any questions into the chat function. You're also welcome to unmute and ask any of the folks on the panel a question or several questions.
The report is now also in the chat.
I know there's no questions so far, but I would say that as a community college president, been in this job for over 14 years, seeing this type of collaboration with the CSU system and industry partners and the other 19 community colleges within the county has been phenomenal. But also to having the steering committee that was created this past year to be able to do this work, and who will also be monitoring the implementation of recommendations. So it's not just a report that's going to be sitting on the shelves. We already have meetings scheduled for 2026 to continue this work, and we've been in conversations with foundations looking at some support as it relates to this work, and also contacting elected officials as it relates to how do we move forward to informing them on the implications from this report, but also how they could be potentially of assistance as we move forward. So it's a good discussion document, but it's also bringing people together and closer around one issue, and we're focused on that one issue that's going to have a significant impact in Los Angeles County.
And Dr. Curry, if I might just amplify a little bit, you talked about some of this began as text messages between you and I. I want to acknowledge and appreciate Dr. Curry's leadership. He also serves on an advisory council for the CSU system as we're looking about the future for strategic enrollment planning and academic program planning. And it was sort of mentioned that this can certainly be a model for California, but I will emphasize that actually I think this is a model that we're using as we think about addressing critical workforce and community needs across the state. This is the model that needs to happen between our educational partners, our workforce partners, our community, our elected officials, as we sort of tackle what the future of California needs. And so we're actually elevating this in our own work as how to bring together communities, regions, counties in this case. And so I just want to amplify that this becomes the blueprint that we can use across other workforce needs, but other regions of the state as well. So as Dr. Curry said, this becomes a conversation starter, and it can be translated into so many other spaces.
Awesome. Well, we could wait until 10:30 if folks have any questions that they're probably thinking about. But as soon as we end this call, I'm going to make sure that I send the press release around along with the report. And I'll re-add my media contact in the chat so that folks have it. And you are welcome to call or email me all day if you need to reach anybody that's on the panel. And if you need to communicate with an industry partner that you see here and have specific questions or would like to schedule interviews with folks, I'm happy to help coordinate and facilitate that. All right, well, I think that'll conclude this virtual press conference.